Bovine viral diarrhea. Flaviviridae has the pestivirus genus. It's a single-strand RNA virus. It's enveloped and has moderate resistance. It survives in the feces and the mucus. It is protected for weeks and direct transmission occurs. It's a Eurixin virus and it physiogenetically used to be the same virus. Cross-infection occurs between sheep, bovine and swine. Cross-reaction occurs in the lab, but there's no cross-immunity. Bovine viral diarrhea. The occurrence is worldwide. It's frequently seropositive. For the etiology, pestivirus A and B make BVDV1 and BVDV2. There is one serotype but two genotypes. The virulence has variance. Bovine viral diarrhea virus 1 has 21 subtypes, and bovine viral diarrhea 2 has increased virulence and has 2A and 2B subtypes. Cytopathic strains have more virulence and non-cytopathic strains are more frequent. For the etiology, the source of the infection are carrier cattle, so immunotolerant calves. The virus is shed in the discharges, saliva, milk, semen and feces. These discharges can enter the body orally, aerogenically in the nose, and through direct contact through mating in the semen. They're a Eurixin virus, so they affect cattle, sheep, swine, goats. And the goat milk can transmit the virus to humans. It's a zoonotic infection. There is no vector. For the pathogenesis, the virus typically enters the body orally, and then the primary replication happens in the gut epithelium and the lymphatic tissue. Then a viremia occurs and it generalizes, and then the secondary replication happens in the lymphatic tissue, which causes immunosuppression, which allows for a co-infection, and the blood vessel endothelium, which causes hemorrhages, and the epithelial cells and the mucous membranes of the oral cavity, which leads to erosions, but these are rare. There are often infections in pregnant cows, especially the first pregnancy. It depends on the virulence of the strain, whether it's cytopathic or non-cytopathic, and the age of the fetus. In cytopathic strains, cows will show clinical signs such as respiratory problems or diarrhea. In cytopathic strains, so before day 40 of pregnancy, there can be embryonic death and infertility. And before day 180, there can be abortion, especially in the first pregnancy. And before giving birth, there can be fetopathy, central nervous disorders, cranial defects, and joint defects. In non-cytopathic strains, the cow has no clinical signs. In the fetus, before day 40, there's embryonic death and infertility. Before day 120, there's immunotolerance. And after day 120 and before giving birth, the animal is seropositive. In regards to the immunotolerance that occurs before day 120, the virus can colonize before the immune system develops. And when this happens, the body recognizes the viral antigen as its own antigen. This is a very big problem in point mutations, since it's an RNA virus, as the non-cytopathic strain can mutate into a cytopathic strain. This can cause mucosal disease, also known as MD. So immunotolerant cows get superinfection with cytopathic strains, but the immune system does not recognize it and the virus multiplies without any inhibition, which leads to severe disease. It usually happens when there's a point mutation when a non-cytopathic strain switches to a cytopathic strain. For the clinical signs, in cows, it affects cows between 4 to 24 months old, especially heifers. In non-cytopathic strains, the animals are usually asymptomatic, or they can get immunosuppression, which can lead to fever and depression. Co-infection is usually due to the immunosuppression, and this is where we can see the clinical signs. The clinical signs are mostly respiratory. In the cytopathic strains, we can see erosions on the mucosa, on the tongue, lips, and nose. They are rounded, oval, and have sharp edges. Diarrhea can occur, and also abortion. In calves with mucosal disease, they can get hemorrhagic enteritis and bloody diarrhea, and they can get bleeding out the nose and mouth. In the fetus, we can see brachynathia superior, hydrocephalus, and ankylosis and ataxia. In sheep, we can see fetopathy, or they can be asymptomatic, and in swine, we can see respiratory problems, or they can be asymptomatic. In the pathology, it's mainly in the case of mucosal disease in calves. They get hemorrhagic enteritis. On the mucosa and the intestines, there's ulceration and erosions. And on the pyre patches, there's inflammation. In the fetus, we can see cerebellar hypoplasia and micropalaemia. For the diagnosis, we need to look at the epidemiology, the clinical signs, the post-mortem lesions, but it's a notifiable disease due to the similarity to foot and mouth disease. It's IOE listed. To detect the virus directly, we can do real-time PCR of the discharge and the semen. We can do IF and immunohistochemistry, and we can also isolate the virus. To detect the virus indirectly, we can do cross-reactions. Viral neutralization is best. In bovine viral diarrhea, GP53 is the neutralizing antigen. We can also use ELISA. For the treatment, we do supportive and symptomatic care. For prevention and control, the most important thing we do is selection of immunotolerant cattle, and then cull and remove them from the herd. These animals are persistently infected, and they are intermediate shedders. We can also do an indirect antibody detection test. Infected animals are positive, and then negative animals can be truly negative, or they can be have a tolerated infection, or they can be in the acute phase infection. Then repeat the indirect antibody test 2 to 3 weeks later. By this time, the acute phase will be positive. And then the truly negative will be negative, and then the tolerated infection will also be negative. You can differentiate between the two with 2 different methods. The first type is by vaccinating the herd, repeat indirect antibody detection. In this case, negative animals will be seropositive, and then tolerated animals will be negative. Or do direct antigen detection tests by using real-time PCRs. Truly negatives will be negatives, and then tolerated will have a positive result. The ear skin cartilage is tested. For the eradication, it was successful in Scandinavia and Western Europe with the above method. Others do embryo transfers as the ovary is not affected and herd replacement. For the vaccination, you do an attenuated live vaccine in the case of an outbreak. There's also an inactivated vaccine. It's safer, but doesn't have as good immunity. It needs to be repeated. The vaccination can cause bleeding calf syndrome. It is suspected to be a cause by the immunization against bovine viral diarrhea virus 1. It occurs in calves that are 3 to 4 weeks old, and they get neonatal pancytopenia. They get bleeding everywhere in the skin and in the feces, and there's a high mortality.